one of the things that I see as the area of development in healthcare is we don't use social media in ways that I think could be very supportive of what we're trying to do from the standpoint of not only healthcare, but just health of communities. It's sometimes called public health, but it's just on this realm of how do we promote the idea that healthy communities are strong communities, and how do we use social media to support not only the delivery of healthcare, but the ideas around health that reduce the use of healthcare over time. Simple example, we have skyrocketing obesity rates in this country, and obesity is probably one of our largest public health issues. But how do you use social media tied into community activities that help promote the concepts behind healthy eating, activity, and then health care as it supports those that are sort of going down that realm towards diabetes? And the reason why I'm putting this out there is when you consider a disease like obesity and then or diabetes, which becomes as a result of obesity, you're talking about changing behavior. It's all about changing behavior. I've been fascinated how social media changes behavior, both in good ways and sometimes not so good ways. So focusing on the good ways, how can we use those tools, technology if you will, and principles and concepts to apply to communities to get to a higher level of health overall? So I have a great question out there. I don't know what the answer is, but I know it's out there. I know, and we're not farming it. Do you know what I mean? We're not paying attention to that because in healthcare we're struggling with health reform, state budget cuts, how we're going to continue to do the day-to-day, much less get ourselves ahead of the day-to-day and look to the long term. But I really think that there's a lot of potential out there that I hope that as an industry we can start, and maybe it requires some entrepreneurs to be focused on that and help us adapt those social media tools to other areas.